What's up, everybody? It's your girl, Felicia from Magic 1013, Grown Folks Radio, 10 to 3 Monday through Friday, and I'm back for the River Valley Black Chamber of Commerce's first Health and Wealth Expo. What we're talking about today is how do we find providers that look like us? How do we get their information? What do they do? Where are they? You know, how do we really spotlight them? So we got some amazing panelists here today. And I'm gonna start with the twins. It's obvious that they're twins. They dress just a little bit differently. So we're gonna split my glasses. That'll help, right? Ladies, thank you for joining me. We have Dr. Lakeisha Story.
Yes, ma'am.
And we have Dr. Letitia Walker. Did I say that properly?
Yes.
Okay. And you are both eye care professionals in private practice.
Yes.
Thank you for being with us. We're going to wrap back around in a second. We want to greet Dr. Marquita Jones. And I want to make sure I get the title of what you do. I want to pronounce it right because
It's a long word.
it's fancy. I like it though. Let me try to get it right. Kinesiotherapy, and you do performance enhancement. So
And pain management.
and pain management. So we're going to get back to all of those things. Ladies, first of all, thank you for joining us.
It's our pleasure.
And as we stated to the audience, we want to know, how do you really spotlight providers that look like us? And how do people who look like us find you all? So we're going to start with you, Marquita. How do your clients find you? Clients that look like you, what they need from you, your service. And tell us just a little bit about your service, but how many of your clients, your patients have said, hey, I'm glad I finally found you and you look just like me?
When I initially started, most of the patients I received were through my recruiting for patients for my research. I was testing out a intervention using sports performance to see can I cross that bridge into pain management with people who suffer from rheumatoid arthritis and osteoarthritis. I go into low-income communities and attend some of their events and kind of throw myself out there. But typically, it's a referral, like word of mouth kind of thing. I've never really had anybody who found me through just finding my website or just kind of like happening upon it.
So what is the percentage of your clients or patients, that look like us? What is the percentage?
All of them.
All of them, okay. So that's amazing. Then obviously they're finding you. They're finding you, so that's a blessing. So probably when we wrap back around, we're going to ask a little bit more about what you're doing so that people do find you, and especially since you're at 100%, your clients do look like us. And I don't want to presume, but are you focusing more so on finding us?
My entire goal from beginning to end throughout my academic career and my professional career was to close the gap on health disparities and target those that were disproportionately exposed to health disparities. That's also women as well as people who look like us.
Yes.
We are the ones that kind of fall through the gaps because some doctors get complacent with the prevalence of diabetes and heart disease amongst us.
Yes.
Also, we just don't have access to high quality resources. What I mean by that, is awareness.
And that's why we're here. That's why we're here. Awareness when it comes to providers, again, that look like us and provide healthcare services to us. So, Dr. Story and Dr. Walker. Now, this is a unique situation, or maybe it's not unique, right?
It's unique.
It is unique. Okay. So can we speak to the unique story of twin sisters, both going into this profession of eye care? That had to be something that y'all were passionate about together growing up. For you both. And you're in, I'm assuming you're in the practice together, are you?
Yes.
Okay. All right. So speak to that if you would.
I'll start speaking to that. Both of you, just in my heart, it was a God-given passion. God-given passion did he tell us to put into front of us? And he both gave us a passion to love and a passion for healthcare, and he just guided us into the industry of optometry, and here we are, practicing together.
Yes, yes. We started, we didn't start growing up thinking eye care. Once we got into college, we both actually, she gave me my first job at the School of Optometry. She helped me get that job. She was already there, and we just fell into it. We got familiar with the students, the professors, and just the profession as a whole, and just started to love it. Originally, we went into just pre-medical, didn't really know what we wanted to do with it, and so many years later, we're practicing together here.
I love it. I love it. And just as I was talking with Dr. Jones, and let me make sure I correct it because I don't think I called you doctor earlier. So Dr. Jones, how do your patients find the ones that look like us, and what is the percentage of your patients that look like us?
I would say we're probably at 50-50, if not a little bit more.
Okay.
I think a drawback is more of the education around the industry and also the importance of eye care. A lot of people don't need to seek out eye care until there's a problem. You don't want to wait till there's a problem. So it's the education that we're trying to get out there, the importance of preventative eye care, and don't wait till you know it's a problem because it may be too late. So the common sense that everyone say they don't want to go without is vision. So we got to just make that a priority.
Love it. Love it.
In terms of how do they find us, word of mouth. We've been practicing here in the Columbus area since, well, I've been here since 2012. Dr. Walker came in 2017. So originally we was practicing separately, and then about 3 years ago we came together. So slowly they're finding us just through word of mouth and just education.
And one clear theme that all three of my panelists have just emphasized is educating our community about preventive care, why it's important, why you should get certain services, and putting themselves out there. Now, when it comes to the actual percentages, now, Dr. Jones, I just want to go back to that. You said 100% of your clients look like us. Do you really feel like a lot of that has to do with your outreach?
Yes. I mean, my as hard as it is, anything that I've done even before achieving that title of doctor, I used to do work at community centers for free, and low-income communities are where it's at. And I don't really want to say that it's about awareness, because that leads to that myth of if you know better, you do better. Right. Meaning that just because the person is aware, they understand. But some people, there's certain parameters of it they understand. For instance, like they're eye doctors, like she's saying, eye health is important. Yes. But the high glaucoma is like a symptom of, or a latent effect of, like diabetes.
Gotcha.
So they get how what diabetes is, how it's treated. Most of the time they assume that it's from the diet, but there's certain other aspects that contribute to it that people don't know about. And when you get to those other aspects, then you kind of get to chip away at what we like to do, and that's why it affects us more. So, like what we used to do at church on Sundays, like we like to eat. We like to eat this, we like to eat that. One of the main contributors to diabetes is central obesity, which is abdominal fat. So it's not so much as eating sugar, it's because when you eat sugar, you consume other things that are high in sodium, high in fat, right? And so you get a lot of inflammation from your abdominal fat. That people don't know that. So once they are aware of that, it's like, okay, so how do I reduce that? Okay, well, let me tell you how exercise is, exercise is medicine. So I stick with that because I see a lot of our culture and our norms. And like she said, people wait till it's too late, until they have that stroke, until they they realize that they already had diabetes. So because we had these things that become our religion, our culture, and our norms, they become like a generational curse. And I'm here to kind of, break those generational curses amongst our people. So I keep my target audience are those that suffer the most. And I feel like when you go into the suburbs, they have access to those resources, but they don't communicate it to us in a way that we get it, is what I'm trying to say.
Yes.
Like, oh, it's essential obesity. What does that mean? Yes. It means that when you be like, oh, I got a pooch, you're kind of getting there. So I like to kind of speak our language to reach us, I guess, so to speak. So I don't really want to say it's about awareness, but I like to speak our lingo and go out into the communities, and that's how I end up with people who predominantly look like me.
Well, thank you for making your practice us-centric and really getting out there and doing that outreach. We appreciate that so much. Now, Dr. Story and Dr. Walker, so what can you maybe advise or speak to when it comes to our community at large, when it comes to finding you all, letting them know what are some things that they can start doing, like you said, before it gets to be a problem, but emphasizing, yes, we need that preventive care. You got to start digging sooner, but also, if you're going to start digging sooner, how do you find providers like you all, so that it makes that journey just a little bit more, and I don't want to say palatable, but I will say comparable, relatable, because our families look like each other, our histories are intertwined in some way, our stories are kind of the same, so at times we feel a little bit more comfortable with providers that look like us, because those things are, so the things are relatable. They're common. So can you all speak to that a little bit when it comes to specifically your profession? Like you said, sometimes people wait until they're, and I don't even know what this is, nearsighted, farsighted. Because let me tell you, I had LASIK like 7-8 years ago, and the last year I have needed these readers, like I've needed oxygen. So how do you get people's awareness up when it comes to getting to you sooner, and your advice when it comes to finding providers that look like you all?
Yes, I'll just say it starts now. It starts today. And it's that preventative care. The importance of comprehensive eye examination. A lot of people just look at vision as what can I see, but it goes beyond that. The vision, the eyes can tell everything about, and a lot of things about what's going on in the body. Sometimes we're the first to diagnose diabetes, high blood pressure, cholesterol, and it's best to treat that early on so that we can get some effective treatment that's gonna, long term be better for the patient. So it's not just about, I can see, so why would I go to the doctor? It's the overall health. So it's important that we be a part of that healthcare team as well. And it starts young. We see pediatric patients, we see as early as 1. We come in there, we learn the skill set early on, how to do the pediatric, so we go all the way up until, older adults as well. So every year, sometimes it takes more than that, just once a year, if you have those systemic conditions. So,
just like Dr. Story was saying, some people come in and they say, hey, I have my eye exam that's online. So what can you tell me online eye exam? Only thing you can tell is, can you read that 20/20 line? Did they dive in and see your eye pressure? Do you have glaucoma? What about your family history? Do you know that African Americans were more likely to have glaucoma, diabetic changes? So when we're thinking about the eyes, we have to think more than, like Dr. Story had mentioned, what can I see? Because we want to make sure that you continue to see as well.
So, yet another information-packed segment. I just want to say thank you, Dr. Jones.
So before, I know we had to hurry up and go. So how do patients find people who look like us? And I would say, as a patient, when it's time to choose a provider in your network, I look up those names and I go and Google that name and I look at that doctor. And if I'm getting a referral, before they even give me that referral, let me look up the doctors that's in this network, and I go and look. I knew who they were before I met them.
I love it.
Because when they said, I said, let me see who she is. I see who she is.
I love it.
So if they want to find a provider that looks like us, they don't have to settle for what they're giving. They can research providers in their network through their insurance website and look at everyone through Google.
Thank you, Dr. Jones. Research. That is what we're leaving it on. Research. So even when you get that referral, Google the doctors, look them up, see what they got going on, and then accept that referral. Thank you, Dr. Jones. Thank you, Dr. Story. Thank you, Dr. Walker. I appreciate y'all so much. Yet another informational packed segment. And we're going to be back in just a little bit with more of the River Valley Black Chamber of Commerce's first Health and Wealth Expo. Thank you again, ladies.
Thank you.